Looking for best hair transplant advice? Well, you have come to the right place, and today in this video we are going to discuss a young man suffering from an advanced grade baldness and how a hair transplant made an amazing difference in his confidence level in his personal life. I am Dr. Satya Kumar Saraswat, a gold medalist plastic cosmetic surgeon and a diplomat of American Board of Hair Restoration Surgery and a life member of ISHRS, that is International Society of Hair Restoration Surgery. Also in this video, we are going to discuss about our unique first in the world application which is AI based. This predicts or gives you a peek into the kind of results you can expect after your hair transplant. So this 25-year-old male came to us with a history of hair fall and hair loss happening for a period of 5 to 6 years. He had taken minoxidil and some treatment, but it was not very effective. He was combing his hairs from the left to right, trying to camouflage or minimize his hair loss. But when we spread his hairs out, we could see that he was suffering from a grade 5 Norwood male pattern baldness in this case. So as is customary, we did a trichoscopy of the donor side as well as the recipient side. So in his case, we could find that its average density of follicular units was 85 follicular unit per centimeter square in the donor side. His hairs were extremely good. They were 0.076 millimeter. His average number of hairs per follicular unit was also on the higher side. It was 2.18, and his coverage value was again fantastic. It was 14.08, which is very high. So this gave us a lot of confidence in this case. We plan it in 2 sittings. In the first sitting, we do cover from the mid frontal point or the front hairline up to the transition zone. This is the point from where the scalp starts going down. We try to not to do the crown in the same sitting, as sometimes there are some problems with the results due to various reasons. So this was his trichoscopic finding in his case. His donor side was more than 154 centimeter square, and average density of 85 follicular units per centimeter square gave a yield of more than 13,000 follicular unit, which was again very good, and we were very happy about it. Please like the video if you like the way in which scientifically we go about planning each and every case. Then we measured this area. This came out to be around 114.5 centimeters square. We planned a density of 35 follicular units per centimeter square in the recipient area. Thereby he was needing around 4,000 graft in this case. So here on the screen you can see the number of grafts we used, also the number of follicles or hair. If you are planning a hair transplant for yourself or your near and dear ones, you can either write down in the comment section below, or you can call us at the numbers mentioned here, or you can WhatsApp us your pictures and your hair loss problem on the numbers here, and then we will try to reach out to you, giving you a customized plan about it. We did his blood test. After this, we fixed up a day for it, because in one day a good clinic does not more than 1 hair transplant. After fixing up a day, he came on that day. We did his sensitivity test and gave him antibiotic shots. Then we marked his hairline. The hairline was around 6.8 centimeters from the glabella or the midpoint of the eyebrows. We marked his angles. After this, we trimmed his hairs, gave local anesthesia using some vibration devices to minimize the discomfort of local anesthesia. Then we made the sides. After that, we extracted the grafts using a low torque and low rotation per minute machine which we have. It's a specialized machine. After this, our team inserted the grafts into the sites or the slits already created. So this was his entire procedure. After that, we called him for shampooings. Then we called him for PRP routinely, and he came for the follow-up as we had told him to come. And then when he came at 6 months, we were very happy to see naturally growing hairs and good result out of the hair transplant in a very early phase. At 6 months, we were very happy. His confidence level was also boosted. His family members were also very happy, and that made us even more happy. We request you to subscribe to our channel so that we are motivated to make such useful videos out for you. Also, now coming to the app which we have discussed about. In this app, if you build up some basic information, you get AI algorithm predicted result which you can achieve in your particular case. It's very easy to use, simple to download, and it's absolutely free. The link of this app is given in the description below. We would like you to take a few points with you after watching. These are very useful points which you should be knowing about, and this should be the deciding factor in your hair transplant whenever you're planning it. Point number one is to check out the credentials and the degrees, qualifications of the doctor, what kind of planning a clinic is doing, what kind of gadgets they are using in planning your transplant. Point number three is what kind of safety equipments are there. Point number four is to check out the transparency of grafts, whether how the transparency about extraction and insertion of graft is communicated to the patient. Last but not the least, what kind of team that hospital or the clinic has. Is it a regular team or is it on day-to-day hiring basis? If it's a day-to-day hiring basis, that means there is hardly any investment in your long-term follow-ups by the team or the clinic or the doctor. So these are some important points which you should be knowing about before actually planning your hair transplant. If you are planning or your family member, your friends are planning a hair transplant, we request you to share this video with them so that they also get authentic information about hair transplant. You want to know more about medical treatment, especially minoxidil, you can watch the video on the left. If you want to see one of our other hair transplant results, you can click the video on the right.